over the last couple months. One of the things I'd like to tell you is that the Texas School Health Advisory Committee is a state-level committee that represents the 8 components of coordinated school health. We do have parents on the committee. As required by statute, the Texas Education Agency and the Texas Department of Agriculture serve on that committee, as well as representation from the Department of State Health Services. So we really work hard to provide tools and resources that can be utilized by the local school health advisory council. And they have really been working hard to give you some additional resources and additional products to help the school health advisory councils at the local level. So we have some things that are already there that are being updated. We have some things we'd certainly like to continue to hear from you all, what kinds of things you need. But we will be putting those out in the Friday Beat so that you're aware of those. So they've got my PowerPoint up, so let's take off. Next one. It takes a while to hit the next one.
Apparently so.
Okay, so they've got the first slide up. Technology is wonderful when it works, right? Oh, good, yay, it works. Okay, so this slide is kind of a representation of what it is like during the legislative process. And as you can see, there are 2 columns, one on the left, one on the right. The one on the right, or on the left, represents the process that happens if a bill gets filed and goes through the House. And the column on the right is what happens when it goes through the Senate. And what's interesting is once it finishes on the left-hand side of the page, the bill has to go to the right-hand side of the page and vice versa. And so a bill can be filed in the House or the Senate. And the reason we talk about this is sometimes the folks you're working with at the local level on your SHAC don't necessarily understand the legislative process. Now, we've all had government courses in our schoolwork, but I don't think that government course is even going to describe what goes on in Austin during the legislative session. And so this is just kind of a visual to show that it's a pretty complex way of getting things moved through. But if you'll notice, there are 3 red arrows that point to very specific points in the process. And those 3 red arrows represent the times in which people can give input to the process. And so that is during committee meetings in both the House and the Senate. And then at the bottom, once the bill has been approved by the House and voted on by the Senate and everybody's hunky-dory with it, then it goes to the governor. And there's an opportunity there for folks to give input to the governor so that he can decide whether to veto the bill, sign the bill into law, or to let the bill go into law without his signature. So I really always try to point this out to folks that there are opportunities for people to give input. And so these are things that you can share with your school health advisory council and let them know that the process, although it looks very complex, it's very important we hear from the public. And we as public citizens certainly want to make sure that our voice is being shared with our legislators. In looking at the 83rd session, you will see that there were 6,636 House bills filed, and that was the total number. And there were a little over 3,000 Senate bills filed. Of those bills, 1,573 were signed by the governor, 26 were vetoed, and 14 bills passed into law without governor's signature on Monday, June 17th. After the session is over, the governor has a certain number of days, and I guess that's the other thing you need to kind of be aware of, is there are timelines for each piece of the process. And so the governor has until June 17th to sign bills or to veto bills. And so you'll see there at the bottom, this is kind of a breakdown of the number of total bills that are now law. I got all of this information off of Texas Legislature online. So at any given point in time, it really helps to go in and be involved in that because you can get in there and track bills by topic. You can get in there and look at how a bill moves from one point to the other. A lot of times the hearings are in there. So these are some of the things that you can actually work with your school health advisory council and explore, because it's really important that people understand the process and understand what it is they can do to influence what goes through the legislative process. Now, one thing you need to be aware of, I've had many people call me recently and think that a bill had passed into law when in reality it had only passed out of one side of the legislature and it had not gone to full enrollment. And so I wanted to put in a couple definitions so that folks understood that when a bill is called engrossed, it means that it has gone through one half of the process. In other words, it's gotten out of one chamber, either the House or the Senate, and it is moving towards the opposite side of that chart that I showed you at the beginning. When it is enrolled, it means that both the House and the Senate have looked at the bill. It is identical, and it's being prepared, or it has been prepared for signature by the governor. So when you go into some of the Texas legislature online and you're looking at bills, you want to get to the very bottom and you want to get to the enrolled bill, because that is the language that was sent to the governor. One of the things that we do at Department of State Health Services in order to keep track of everything, and this is by no means all the school health bills, we put together a document that pretty much kind of summarizes what the bills are. And this document is available on that website that's listed there in red. And it's still on the front page of the website. And so what we've done is we put together this document to where you can go in. When you see that hyperlink number and you click on that, it will take you directly to the Texas legislature online, to the main page for that bill. And so this is something that you have access to that can help you go in and get the language of the current bill. We do have these from previous years, and so certainly if you needed something from a previous year, we can get that for you. But this is really another key piece that you could actually share with your school health advisory council, letting them see the types of bills that came through the process. Now, I do have to say that there are a couple places on there. You see a whole lot of blue on that slide. And what those two bills are, those are two bills that have been vetoed by the governor. And so what we did to make it very easy for you as consumers is we actually linked you to the governor's veto statement. And so you can actually go into that document, click on those blue long lines, and it will take you directly to the statement that was made when the governor vetoed those two bills. So some of the other presenters are going to get into many of these bills. I know that I didn't want to duplicate anything that Barney was going to present on. So what I did was I kind of took a step back and looked at some of the items that were of interest to nursing services and health services, and then also making sure that you see which of the bills were vetoed or which of the bills timed out. Senate Bill 418 actually timed out of the process. It was the bill that required a school district to send notification if a campus did not have a school nurse. It never made it completely through the process, although it did make it out of the Senate committee and out of the Senate side. And so this bill itself made it quite far through the process, which it hasn't done before, but thanks to Texas School Nurse Organization, it was able to get out of the Senate and actually was over in the House side when it really timed out. And I told you about the timelines that things have. It just never made it completely through the process. Senate Bill 504 related to spinal screening requirements. It made it out of the House and it made it out of the Senate, and it was vetoed by the governor. So I want to let you know that we are still requiring spinal screening in grades 5 through 8 or 6 and 9. 5 and 8 or 6 and 9. That bill would have eliminated the requirement and added in that they either had to screen or they could give information to parents. But because that bill was vetoed, we still need to do the spinal screening as it has been in the past. Senate Bill 521 related to parental approval for sexuality instruction. This one made it out of the Senate committee, but it didn't make it out of the Senate. So in other words, this was another one that timed out through the process simply because there wasn't enough time to get it all heard. House Bill 217 related to beverages that may be sold to students on public school campuses. Again, this bill was vetoed, and so I would encourage you to go into the past document that I showed you and actually click on the bill, the statement below the bill, and it will give you the governor's statement on why he vetoed that bill. I know that Barney and somebody from Texas Department of Agriculture are going to go over some of these other bills, so I won't spend too much time on them. But as I said before, if you go back into the document that I just shared earlier, you will see that all of these bills that passed are listed there, and they are hyperlinked so that you can go in and actually pick out the language from the bill directly. What will happen is it will take you to the front page, and on the top there's a little tab that says text. And when you go up to that tab and get to the text, just remember you're going to want to pull down the enrolled version. This actually might be a good activity for you all to do during a SHAC meeting, just to kind of show them how to find things in TLO, Texas Legislature Online, because it's got a wealth of information. You can actually listen to committee hearings to see who's testified for different bills, and you can actually listen to the testimony, and it's quite fascinating. But certainly it will help in giving your SHAC an idea of how things do come to pass in the law. One law that one bill that's been filed at the federal level is H.R. 1857, and I'm not sure how many of the school nurses know that this bill has been filed at the federal level. I have not seen any movement on it. I do believe that they are getting more co-authors and they are getting more folks to sign on to this bill. However, I do not believe it's moved anywhere. What this bill would do, it would help develop a grant program to help improve student and nurse ratios. I think one of the caveats with this bill that I noticed, and I'd encourage you to go to the link and actually pull down the language. There's some guiding principles about how many students have to be enrolled in the school, and I believe it's about 10,000. So for many of our smaller rural districts, that probably isn't going to be a grant that would afford them the opportunity that a bigger district would have. But certainly we're going to be keeping an eye on that bill just to see where it goes and to see how many folks are really interested at the national level and see who might help us get some more information about that particular piece. Now, after the legislative process is over, after things are said and done, rules have to be written. And I know right now there's several of the bills that will have to have rules written. Within our agency, I wanted to give you 3 examples. We had to write rules on the Texas School Health Advisory Committee outlining who our membership would be, how often they would be sent forth to the Commissioner of Health for review and approval. There's a whole lot about how that committee runs and what we do. And so we had to set out those rules. School-based health centers, we have rules that have been developed in how we give grants for school-based health centers. So again, the rule process has to be done prior to it being sent out to schools. And one, it wasn't this last session, but it was the session before. Somehow our school health program was charged with writing rodeo rules. And I don't know how many of you all know that there are actually rodeo rules out there that pertain to children participating in rodeos, and that there has to be an education piece as well as there has to be protective equipment looked at to make sure that there's helmets and vests. And so this was one that we actually didn't even know the law was going on the books. We pretty much learned about it when they said you're going to be writing the rules. But once the rules were written, we try to get that word out to as many folks as we can that the rules are on the book. Rules carry the weight of law. So when you're looking at the law, you also have to consider the Texas Administrative Code, which is where all of the state rules are located. So just so you know that there's another step in the process. And so when Barney and I are given bills to analyze and bills to begin writing rules on, for our agency, it can take anywhere from 6 months to a year to get everything done that needs to be done to write the rules. We were assigned last session the food allergy guidelines, and so although they're not rules, they are considered a guideline for school districts to use as they implement food allergy and protecting students from food allergy. At this point, I don't know if we have time for questions, if we want to wait till the end to do questions, but I guess we can open it up just shortly and see if there's any questions.
We're going to get to that. We're going to get to those. Okay. There's a question from one of the webinar participants regarding House Bill 897 and House Bill 2483, and I'll actually cover that information here in just a second.
This is my contact information, so if any of you have questions, if you want some information about what the Texas School Health Advisory Council is doing, if you want to get on the Friday beat and you can't quite figure it out, please don't hesitate to contact me. We certainly want to get you the information you need, and certainly this is one of those times where everybody's looking for a lot of support, and we certainly want to do what we can to get you the best information. I do believe these slides will be available, and my thinking is if you can take anything that I put in a slide and use it, please do so. All that I ask is that you reference that it was from the Texas Department of State Health Services, primarily just so that they know that we were involved in the process. But you can take any of these slides and use them any way that you would like to. Thank you. If anybody wants more information on HR 1857, the one on school nursing, NASN is tracking a lot of that, so I would encourage you to get on the National Association of School Nurses website because they will have a lot of that information. And they actually are one of the best partners at the national level that we have as in promoting school nursing. So thank you very much, and I appreciate the time you let me share with you this morning.
All right. Now we'll move into the Texas Education Agency update portion of the presentation. And this slide here is just our disclaimer information there that everything's copyrighted today by the Texas Education Agency. Our objectives and things we want to talk about are obviously the changes in legislation that were made this year. Also want to give a brief update on the call for programs for coordinated school health programs. And then we closed out the CDC grant that TEA had regarding HIV education and prevention, and I do have a slide regarding that. We did have a materials review panel that met. I have some. The panel had some recommendations for HIV prevention education. Talk a little bit about food allergies. We've already mentioned that. Just to give a brief update again on the food allergy information, and then I'll close out with the changes or the revisions to the fine arts text for dance. So House Bill 897 basically requires the State Board of Education to include instruction in CPR in grades 7 through 12. The instruction needs to be given at least once before graduation, and the State Board of Education is also required to do some rulemaking on this, and I have a slide later on in the presentation that addresses that. A school district may waive the requirement for for a student that has a disability, and instruction provided under this bill does not have to result in CPR certification. But if your intention is to have the CPR certification, that the students be certified in CPR, the course instructor has to be authorized by the American Heart Association, the American Red Cross, or some other nationally recognized association to provide that instruction. And then the training that you utilize, it has to have been developed by the American Heart Association or American Red Cross. And you've got to use nationally recognized evidence-based guidelines for emergency cardiovascular care, and incorporate hands-on practice in the instruction. And to cover this, the bill outlines various entities that can help you do that: EMTs, paramedics, police officers, firefighters. It gives a pretty exhaustive list there of who can assist in providing instruction and training. And again, this bill doesn't take effect until the 14-15 academic year. So the action that is required for this year is that the State Board of Education is going to have to do some rulemaking on this new requirement. So more information is to come regarding this. It'll probably be done at a meeting later in the future. I know that they've got a full agenda next week, and this isn't one of the items on the agenda. But for a future meeting, they will have to do rulemaking on this. And information regarding this will be sent out on the Health and Safety listserv. I'm also sure that it'll probably be posted on the School Health Programs webpage as well once this information comes about. So more information to come regarding this. And if you have any questions regarding it or want to discuss it further, you can call or email me. House Bill 1018 was effective September 1, and it amends 28.004 and requires the establishment of community partnerships and policy recommendations for increasing physical activity. And so basically, in addition to the established duties for the SHAC, the SHAC must recommend, if feasible, joint use agreements between community organizations or groups or agencies that the SHAC could possibly partner with to provide any kind of physical activity outside of the school day. Or oftentimes, when you get out into more of the rural communities, particularly out in West Texas, the school may be the only place that the community has to have a gym or to have a track or to have access to the facility. So this is kind of what the bill is referencing and talking about. And any agreement that the district or community organization or group enters into must be based that's based on the recommendation of the SHAC must also address the liability for the community organization and the district as well. And then this bill also requires SHACs to establish a physical activity and fitness planning subcommittee to consider issues relating to student physical activity and make policy recommendations regarding student fitness to your local board of trustees. And then the annual SHAC report must include any recommendation that the physical activity and fitness planning subcommittee should make. So a few months ago, Anita referenced the Texas School Health Advisory Committee and their website, and on that website there's actually kind of a template of a board report that you could fill out to present to your board. And so this would be one of those requirements that would go in that report to your local board of trustees. House Bill 2483 changes, it adds to 38.013, which is the requirement for coordinated school health programs, and it adds the addition of oral health education to the health education component of coordinated school health programs. And we currently are going through a review now for coordinated school health programs, and we had 6 vendors that have submitted and 4 school districts that turned in curriculum to be reviewed. And so that was, the deadline was August 30th for that. So now we've gone into the selection of the committee, and that's what we're currently working on now, is to select a committee to review the programs that have been submitted. And then once the committee has identified programs that they want to have approved, then that list will be posted on our website. I will send out information through the health and safety listserv, and then we'll have a new set of programs that have been approved for the next 4-year cycle. So in the meantime, what the agency is recommending, until we can get a list of newly, or not newly, I don't even know if that's a word, a list of new approved programs, we suggest that you continue utilizing what you currently have until a new list can be produced. Senate Bill 1 had a rider attached to it. I believe it was rider 74. Might have been 78. For some reason that sounds familiar, but I'm not exactly sure. But anyway, there's a rider attached to it. And basically what this rider did was increase funding by $5 million during the 14-15 biennium for analyzing the fitnessgram data. And it became effective September 1. Excuse me. And more information will be forthcoming about this. I'm still awaiting information from our agency leadership regarding how all this information is going to roll out from the agency. So there's more to come on that. And just like the coordinated school health information, this information will be posted to our website, as well as I will also send out information on the health and safety listserv regarding the rider that was attached to Senate Bill 1 for fitnessgram funding. Senate Bill 460 became effective September 1, and it basically it changed several different parts of law, and it's basically for public school teachers in the detection and education of students at risk for suicide or with other mental health or emotional disorders, and the inclusion of mental health concerns in coordinated school health efforts. So what it did is it added a requirement for the State Board of Educator certification qualifications to have teachers that are in educator certification programs to include a requirement that they receive instruction in the detection of students with mental health and emotional disorders. It amended 28.004, which applies to school health advisory committees, by adding the language of policy, procedures, strategies, and curriculum appropriate for specific grade levels. So now we've got to look at policies, procedures, and strategies in addition to the appropriate grade level curriculum. And then it added mental health concerns to that. So it's prevent diabetes, cardiovascular disease, prevent obesity, diabetes, cardiovascular disease, and mental health concerns through a coordination of. And then it has the 4 components, and then it added the remaining 4 components to coordinated school health that weren't currently present, which were school health services, counseling and guidance services, safe and healthy school environment, and employee wellness. Nita, do you have any information or anything you'd like to share or add to that? Okay, it also amends Health and Safety Code 161.325, which was actually added in the 82nd legislative session by House Bill 1386. And so the guidelines for training were outlined in House Bill 1386 in the 82nd legislative session, but now what Senate Bill 460 did is it actually says each school district shall provide training. It was permissive in the last session, but now it states that each district shall provide training for teachers, counselors, principals, and all other appropriate personnel to recognize students at risk for committing suicide especially those that are victims or engaged in bullying, recognize students that are displaying early warning signs, and intervene effectively with students by providing notice and referral to parents or guardians. And Nita, do you have something you'd like to add to this?
I would like to say that funding has been provided to the Department of State Health Services, the mental health program. As soon as we know exactly how these types of trainings are going to be done, we will certainly put that in the Friday Beat. We'll work with Barney in getting the information out. Our understanding right now is they'll be working through the local mental health authority, and many of you all have very good connections, and some of you don't even know who that is. So the minute we find out more about any kind of training that's going to be done related to suicide and mental health, we will get that out as many different ways as we can.
Thanks, Anita. Bill further requires the district to provide training at the elementary school campus only if funding, if sufficient funding and the programs are available. And then to satisfy the requirement, the school district may implement a program that's on the list. And the list that they're referencing is from the previous legislative session. That's the best practice registry that is located on the Suicide Prevention Resource Center website. And I've provided that link. And then you can also get to that information from the Department of State Health and Human Services web link as well that I've provided. An employee must at least participate once in the training. In the school district, it must maintain all of the records for those staff members that have been trained as well. And this is the main page for the best practices registry on the Suicide Prevention Resource Center website. And it gives you kind of an overview and then the information, and then you can go in and select an evidence-based curriculum from that website, or you can go to the DSHS website as well and navigate that information and find out information about programs that are also offered there. Senate Bill 831 is another bill that was filed that impacts mental health, and it relates to a list of mental health, substance abuse, and suicide prevention programs that may be selected for implementation in public schools. And what that bill requires is that regional education service centers, Department of State Health Services, and the Texas Education Agency shall provide and annually update a list of recommended best practice-based programs. So in the previous legislative session, DSHS was given the charge for this, and TEA was just in collaboration with them. Well, now the bill has added the responsibility that TEA post this to their website in a location that's easily accessible, as well as DSHS, and each education service center in the state will also post this information as well. And there's currently a work group that we're working on getting this information out. So there's more to come with that. We've already had one meeting regarding this legislation, and so once we get everything finalized, I'm sure that the agency TEA will announce that through to the administrator address letter, and I will also send it out on the listserv as well on where you can locate that information that's been posted to the website. And the list that's got to be posted needs to address mental health intervention, mental health promotion, and positive youth development, substance abuse prevention and intervention, as well as suicide prevention. And then additional bills of interest that aren't necessarily being monitored by the curriculum division, but I thought might be of specific interest to the general public. I've included that. You can go to the legislature online that Anita mentioned earlier and look that information up there. And here is what the homepage of MyTLO looks like for you to go, and you can set up an account and track and monitor the legislation. And then that concludes the update session, and we've got a few webinar questions.
For
K through 8. Yes, because it goes with Texas Education Code 38.013 is what requires coordinated school health programs K through 8 be taught, and so it 2483 specifically applies to K through 8.
To require health to require school or the continuing certification for those.
I really don't understand the question being asked. I mean, health is no longer a state graduation requirement. Districts can choose to offer health as a local credit. So I'm kind of unclear on the question that's being asked there.
Is suicide training for every employee?
Yes.
There's just a note that Mental Health America of Texas has online free training called At Risk for High School Teachers.
Yes, that is correct. There's it's by incognito, and you can go to Mental Health America of Texas website, and you can get to those links to go to those specific training modules, and you create a login and a password, and so you don't have to take the training all at the same time. You can take a portion of it and then come back and revisit it later. So it's not anything that you have to sit down and do in one large chunk. Okay, coordinated school health programs. There was a posting that went out in the Texas Register calling for programs, and the deadline for submission of those programs, as I previously mentioned, was August 30th. The any information regarding the review and decision on the programs that the committee is going to recommend will be sent out on the health and safety listserv. And to join the listserv, you can go to that link, click on the drop-down menu, highlight health and safety listserv, and then hit click or join, and you're a member. And the currently approved programs are Catch, Being a Star, Great Body Shop, Healthy and Wise, and I believe there are 2 or 3 district programs that are approved. So the recommendation from the agency is that you continue to use those programs that your district has selected to use until we can produce a new list of programs. And then the law regarding coordinated school health programs, the link to get to 38.013 is located there. And then the administrative rules, the administrative code for the selection criteria for coordinated school health programs is PAC 102.1031. And there's the link to get to that information. And then I also wanted to remind everybody that you needed to have in your campus improvement plan, you needed to address your coordinated school health efforts in your SIPs also. The CDC HIV grant has wrapped up, but in February we had a materials review panel meeting to review materials that were submitted to the agency to address HIV prevention and intervention. And here is a list of the programs that the committee recommended, and the power to wait and big decisions were recommended as supplemental materials for middle and high school. But then there's the rest. There's no statutory requirement that you use any of these programs. It was just a requirement of the grant that I convene the committee to review materials and then get a list of materials out there. And hopefully within the next month, this will be posted to our website. I'm currently going through the approval process to get that posted as well. And then food allergies. Senate Bill 27 in the 82nd legislative session established guidelines for students with food allergies and anaphylaxis. And you can there's a link on our webpage down there at the bottom for students with special needs that you can click to get to the actual guideline. And then if you go to the school health programs webpage at Department of State Health and Human Services, they've actually got a very nicely redone copy that's in color that you can click on and look at and download that has the same information. So I just wanted to revisit that again to make sure that everyone was aware that the word guidelines for that. And you can also find more information regarding food allergy and anaphylaxis at the uh, food allergy research and education. I think it originally was called FAN, but now they've changed it was the Food Allergy and Anaphylaxis Network, and now I think they changed to the Food Allergy Research and Education. And they've got a great toolkit and information that you can download and print out to give the staff regarding food allergies. And then also on the school health webpage, as I previously mentioned, the information regarding food allergies there. And then lastly, I wanted to include information about the revised fine arts text for dance. And the State Board of Education adopted the revisions in April of 2013, and the revised text, at that point they were available a month after that, and the texts include middle school dance 1, 2, and 3, as well as a number of high school courses, and that information is provided there. And I'd like for everyone to note that these will not be implemented until the 2015-16 school year. So new dance courses cannot be used to satisfy any fine arts or elective graduation credit until they're implemented in 15-16. And then likewise for new middle school dance courses, those cannot be used to satisfy the middle school fine arts requirement until they're implemented in 15-16. So we still have a while before those are implemented. And for more information regarding the dance Texas Essential Knowledge and Skills, you can contact Jessica Snyder here in the curriculum division. And there's her email address and phone number. And here's also a link to our curriculum newsletter. There'll be a new one coming out for the fall, so you can go to view all the new information that will come out in the curriculum newsletter for this fall. There's my contact information. If you've got questions and were too shy to ask or didn't have time to ask, you can give me a call or send me an email. And with that, that concludes the legislative update session. And are there any? All right. Well, that takes us to our next presenter, Ms. Rose Westerman with the Texas Department of Agriculture. She's going to give us a legislative update regarding. Yes, sir. Yes, sir. I believe those are going to be posted on the Texas Action for Healthy Kids website. It'll be probably maybe 5 to 10 days. PowerPoints as well as a recording to the webinar can be accessed from that webpage. If you shoot me an email, I'll try to get it to you. Yes, sir.
Okay, I am Rose Westerman. I'm with the Texas Department of Agriculture. I am the coordinator for policy, but I am filling in for our legislative liaison, Melissa Dozier, who had a conflict with the meeting. So I am not the normal person that would be giving a legislative update for you. We just have two bills that I'm going to give you an update on. It's the Universal Free Breakfast, Senate Bill 376. And it requires a school district campus or an open enrollment charter school participating in the National School Breakfast Program in which 80% or more of the students qualify for free or reduced price breakfast to offer breakfast at no charge to all students. And this is starting in school year 2014-15. campuses that meet the criteria outlined in Senate Bill 376 related to universal breakfast that do not wish to provide a breakfast at no cost to all students must vote to opt out of the requirement at a board of trustee meeting. Based on the voting outcome, schools may request a waiver from TDA, and this waiver process will be followed annually, and the waivers granted are for 1 year only. We had one more bill, House Bill 1781, which the Texas Public School Nutrition Policy requires that schools may not sell or provide foods of minimal nutritional value during the school day. House Bill 1781 limits sanctions that may be imposed on school districts for the sale of certain foods of minimal nutritional value. And the food sales must meet criteria in order for the sanctions not to be imposed. TDA may not impose a sanction, including disallowance of meal reimbursement, on a school district based on the sale to students at a high school of foods of minimal nutritional value if the sale is approved in advance by the school, is made outside of the school area designated for food service or food consumption, or during a period other than school meal service, and for the purposes of raising money for a student organization or activity sponsored or sanctioned by the school or school district in which the school is located. And that is House Bill 1781. And Melissa did want me to mention that we haven't developed any policies or procedures regarding either of the bills, and that TDA is currently evaluating the bills and will send communication out to schools as soon as possible. So basically, I have no additional information about how those will impact you or what you need to do related to Senate Bill 376, which is universal free breakfast, and House Bill 1781, which is foods of minimal nutritional value. So I think I made up some time for other people on the agenda.
All right. Thank you, ma'am, very much. I
Thank
appreciate
you.
that. Next, we have Mary Starboard with the Texas Department of Agriculture. She's going to talk to us about wellness policies.
All right. Hi, I'm Mary Starboard. I'm the coordinator for nutrition and outreach at the Texas Department of Agriculture, right across the street. I'm happy to be here today to talk to you. I'll give you an update on local school wellness policy. Since June 30th, 2006, school year 2006-2007, schools have been required to establish a local wellness policy for their school nutrition, physical activity, and overall wellness of the student environment. And that federal law was groundbreaking, and in that it was the first federal law or policy-driven action to affect since that has worked to increase the strength of local every school that is under the National School Lunch Program is required to establish policy. Because it is under the National School Lunch Act, a lot of schools you can because it is under the nutrition even among schools that it is the nutrition department that is responsible for developing is in place but actually but more so provides a little bit later. But HHSKA, just like in 2004 when the law was first passed, it was groundbreaking too because it worked to strengthen wellness policy by emphasizing ongoing, whereas before policy was written and them put on the shelf, but there was no true investment in checking on whether or not goals are being made and progress goals are being met and progress. So HHFKA is trying to do away with that and make it possible for local wellness policies to become useful tools in evaluating and establishing healthy school environments. And I do want y'all to just keep that in your mind as I go through these, that it is about the wellness school environment, not just the overall wellness of the environment for that create an optimal environment. HHFK also help provide transparency to the public. Now, the requirement is that progress on the implementation of local wellness policy, how well it's adhering to it's meeting its goals, how well it's adhering to our policies, and it has to be conveyed to the public. That was in addition to the 2004 goals that initially enacted. HHFKA added at a minimum goals for nutrition. In addition to nutrition, other school-based activities, guidelines for all foods available on the school campus. Also, HHFKA required that, in addition to the previous stakeholders involved in development and progress of the policy, which was for school administrators and other educational professionals. The HHFPA requires that teachers of physical education, school health professionals have to develop this policy, and it requires all stakeholders to participate in implementation periodically. So that's the difference. HHFKA also required that, like I said, that the school had to inform and update the public, and again, parents, students, and others in the community about the content and implementation of the local wellness policy. So they would not only be informed, but that they would be invested and hopefully participate more and be interested in how the policy is impacting their children and the overall student population of the school. Also, schools are required to measure periodically and make available to the public an assessment on the implementation of the policy, including the extent to which school is in compliance with the policy, the extent to which the policy compares to model wellness policies, and again, I'm repeating that, but I just want to stress it, and to describe progress made in attaining those goals. Basically, as I said, PDA does administer the policy and provides the training and technical assistance needed for a school to implement it. We do that through our educational service centers. The 20 educational service centers house a team of child nutrition program specialists that TDA funds and supports and trains to provide the technical assistance and then the training to the schools to implement local wellness policies at the highest level possible. In addition to that, to find out more if you feel that your school is not in compliance or is not where it needs to be, maybe is a better way of saying it, with local wellness policy and requirements of HHFKA, they can go to the USDA website for more information on the policy requirements, particularly, and I can send this to Michelle later to have it sent out, the original policy memo that came out in July of 2011 that talks about what I just reviewed, but in much more detail. They can also go to that website and look at the 5-year technical assistance and guidance plan, which is the overall national agenda for local wellness policies, and what the Department of Education and USDA plan for local wellness policies in the 5-year period since HHFKA got passed. As far as monitoring and accountability, if you want to get down to the nitty-gritty, there's basically 5 important pieces of documentation a local education agency, a school district, a school has to keep on file for future administrative review. An administrative review is a formal way of saying when TDA comes in and actually reviews and sees how well that school is aligning with the actual federal regulations of the National School Lunch Program and other child nutrition programs that they participate in. So TDA does conduct these administrative reviews on a 3-year cycle. And one of the things that we do look at is we do monitor how the local wellness policy is implemented and how it's met. And to, again, to be equipped or ready for that, you would need, of course, a copy of your policy. You would need proof of the minutes that the policy was formally adopted, usually minutes from the school board meeting that then adopted it. You would need a copy of the Food and Nutrition Division Form 105, which you can find on our squaremeals.org website, which serves as a checklist that goes through the requirements that I just discussed to make sure that the policy is aligned with them. That form has to be filled out and then submitted to the Educational Service Center in the region that the school is located in. That Educational Service Center Child Nutrition Program Specialist reviews it and makes sure that it does meet the requirements, and then submits that to the Texas Department of Agriculture here in Austin, and we keep that in the school's main file. And then, of course, when we go out for the review, then we go and verify those on site. You would also need evidence reflecting the extent to which you are in compliance with the policy and the progress made. Again, going back to what HHFKA requires. And some sort of evidence that shows the public, parents, students, and the community at large are being informed of your policy's progress in meeting its goals. And these can be printed or electronic materials. It could even be something on your website. And we leave all those decisions up to the discretion of the school based on what they feel will meet their needs to reflect that these things are being met. For more information, yeah, a little difficulty. I think there's a little box. There we go. For websites, for national websites with information on local wellness policies that not just talk to you about the minimum requirements, but we always want to stress people to go above and beyond and look what best practices they could possibly implement, not just to make a grade or pass the test, but to really, really provide a robust wellness environment for the children who attend school there. You can go to the USDA website that here it is, and then also their health website. A lot of and just so you know, when HHSA came out and the language is written about the local wellness policy, strengthening and the transparent and making it a useful evaluation a lot of people were confused because the guidance seems loose. I know we as the state agencies were used to getting a strong regulation, break it down into sections, instructions. It was a little different to us because the language, not vague, but it was a little loose. And so we had to, I received a lot of calls with a lot of presents. But just so you know, we will know the black and white of it soon. There will be a proposed rule. Proposed hopefully in early 2014. I will say it was to actually fall of 2012, so they're a little behind on the timeline, but that I think that's only because they're looking for sure that the full policy. Anyway, so you can look to the regulations.gov website. Do know that as soon as it does come out, we will send it. There will be a public comment period anywhere from 90 to 120 days. I think because of the lateness of the proposed rule, since it was supposed to come out a year and a half ago, the comment period might be shortened to possibly even 60 or maybe 90 days. And then it will become final in late 2014. So that will have all of the information and guidance, and I think it will have all the science-based evidence and even incorporate some of those model wellness policies that everybody is always asking for to compare their own policy to write it. For training and technical assistance, as I said, our educational service center and the staff that we fund and support in those centers are called child nutrition program specialists, and I can send a list of those out to you. Um, so it can be sent out, but they provide the direct training to do the initial monitoring step with that one. But beyond that, if you want to go beyond what's required, go to USDA provides all sorts of resources to USDA for schools and other institutions that they also release grants every a lot of local ones and they at a minimum provide schools. But here are just some of the resources that are available on the Center for Disease Control has a lot of resources. Here you go more into a lot of the science and current research. This is more cutting edge. It's based on research projects that were demonstrated in different schools, sometimes in multiple states. So you would have almost a national representation, or a nationally representative sample that these instruments have been tested on. Maybe some of y'all are familiar with the School Health Index and other surveys and indexes there. They can help you kind of assess your school and provide guidance on wellness policies, provide model language, and make sure that your local wellness policy is not just a policy that sits on the shelf, but it's actually a robust program that's being implemented. In the next slide, you can also go to .gov, and I mentioned the Healthy Youth page, and there's training tools for healthy schools. It has a lot of information on how health and wellness is going to have a benefit and various tools and resources that can benefit a school. NFSMI, which is the National Food Service Management Institute, has a resource called the Resource to Sustain and Strengthen Wellness Initiatives, and this is new. So you can look at that. There's the Yale Red Center, and I think I misspelled that. It's the WellSat tool with one A at wellsat.org. And then, of course, there's Action for Healthy Kids and their wellness policy tool at the website available there. And there's Bridging the Gap at bridgingthegapresearch.org with district wellness policy data. So again, that would be a lot of good homework to do as the school year is starting. If you want to bring your local wellness policy up to par before that, and then just I want to do a little quick plug. Farm to schools definitely should be incorporated and be considered when writing your local wellness policy and thinking about your program. And so I just want to do a plug. Not only does that support our state's agribusiness, but it provides a direct link to foods from their where they're grown directly to the child, the nutrient benefits, the connection of where the children would gain from knowing where their food comes from. There's just multiple benefits to farm to school, and of course, knowing that evidence has shown or research has shown that when children know that, they're more likely to try foods, mainly fruits and vegetables that they're not used to. Do know that school gardens qualify under the Farm to School umbrella, and you can go to the USDA.gov Farm to School website, sign up for the school e-letter on Farm to School, learn more about the USDA Farm to School grant, and I'm not quite sure on the timeline for that, but I think they have closed so that they would open up again in the future. You would find farm to school related policies and guidance, and you'll find contact information for state farm to school coordinators. Here in Texas, we're proud to say our farm to school coordinator is housed at the Texas Department of Agriculture, and that was a result of state legislation to write a report and to show the need for a farm to school coordinator. Her name is Alyssa Harrell, and she sits in the same office that I do, and there you have her email address if you want to get any more information. Okay, and I guess, again, I would stress PDA, because Texas is such a big state, does do its main technical assistance and training through our educational service centers and the child nutrition specialists there. There are 20 of them, and probably most of y'all are familiar with those offices. If you call your regional ESC, you can get in touch with that child nutrition specialist and find out more about local wellness policies, or you can go to our website at squaremeals.org, or you can email squaremeals@agriculture.com.
All right. Thank you very much. We have a question? Yes, we have a question from our audience here at the agency.
I think it would be a disservice not to include the SHACs in the development of the wellness policy. I mean, each school has the discretion, but the more you invite those type of external partners who have a vested interest not only in but outside of the school, you're going to get a more robust policy. You also get more minds to help divvy up the work, and you get those parents involved. The policy is only as good as it's written. Also, if you get the SHAC involved, I think you get more of the ear of the superintendent and the administration, and evidence has shown that if you can get the backing of the superintendent's success, or the bridging the gap of actually implementing that local wellness policy versus just writing it, is more ensured when you get administration involved. And I think the SHAC has a strong voice than just a few school professionals getting together and just trying to meet with the client. Sure.
Any other questions, Michelle, from our webinar participants? All right. Well, thank you very much. I appreciate you coming over.
All right.
And sharing information. Our next presenter is Christy Dimon with Texas Department of Agriculture, and she's gonna chat with us a little bit about National School Lunch Week. We do.
Hi, everybody. Hope you're doing well today. We're going to pull up the National School Lunch Week webpage. It's on Square Mills, so if you'll bear with me just for a moment. Okay. I hope you can all hear me well. National School Lunch Week is right around the corner. It's October 14th through the 18th, and it's a nationally recognized event. And this year, the Texas Department of Agriculture has worked really hard to develop materials to provide to every school that participates in the National School Lunch program. And our theme this year is called Take a Texas-Sized Taste Tour. It's all about recognizing a school's effort to serve fresh foods and showcasing the unique flavors and products our great state has to offer. We hope, or everyone's hope, for National School Lunch Week is that it would generate excitement among the students, from kindergarten all the way up to 12th grade, to go through the line and try a healthy meal. And out of National School Lunch Week, that they would continue to come back and eat a healthy meal in the school lunchroom. TDA has developed resources to help make it easier for schools. You know, the school just kicked off. I'm sure a lot of people have many things on their plate right now. And so to plan an elaborate event for this week can be difficult, especially if it's just one person in charge of it. And so our hope with the materials that we've created is that it would make it easier for an event to take place on each campus across the state. One second. Okay, here we go. We're going to switch now to the website, and I'm going to walk you through it just real quick. I think my biggest ask for everyone that's out there today is that you would make as many people aware
directly get to this website by just typing in squaremeals.org/NSLW. That's National School Lunch Week, the direct link, the direct URL. So we are going to be mailing, starting on Friday, every school in Texas that participates in the National School Lunch Program posters that they can display in their school cafeterias in the weeks leading up to and during the week of National School Lunch Week. These posters are really nice, and I'll go down and show you those on this page real quick. You can see there's a series for elementary schools, and then the second set of posters are for middle school and high school. So elementary has a look, and middle and high school has a look. So everyone will get these in hand starting next week. So as they start going out, schools will have the opportunity to start displaying them in the cafeterias anywhere from 3 to 4 weeks before National School Lunch Week even begins. We also have other materials that we're developing. If it's a link that and up and live, it's in red. So we have an animated banner that schools can download and put on their home web page, and that any parents that are coming onto the website, which they're visited daily by lots of people, they'll be able to see this flashing banner and know that this event is taking place. Wednesday, October 16th, is Bring Your Parent to Lunch Day. So we're really promoting that a lot in the materials that we're developing for National School Lunch Week. We also have morning announcement scripts. Whenever I was a teacher, each morning before classes would begin, we would always have a student go up to the front, and they would deliver some type of message to the rest of the students. And so we've written these with the student in mind. Hopefully it would be something that they could stand up and read. It's very short, succinct, and gets the point across, and it teaches the kids about the different meal components as the week goes on. And it teaches them as well how Texas is producing, how local farmers and ranchers are providing great products to us. We also have a suggested menu and an October menu calendar template. I want to deviate from this page just real quick. I want to click on suggested menu. This is really important for school staff and nutrition staff to know about. We have worked hard to develop a menu for the week of National Lunch Week that features Texas products. And so you can scroll down and you can click on the recipes for Monday, and it's porcupine sliders on a whole grain mini roll, and then scalloped potatoes, green beans with cheese sauce, veggie sticks, ranch dressing, fresh grapes, and milk. So everything is here, and if they click on these are USDA recipes. They're linked to the recipe. And so you can also, up here, there's a shopping list as well as a component contribution for the K-5 meal pattern available just by clicking here. Hopefully in the coming weeks we'll be able to add 6 through 8, 9 through 12, but right now we have K-5. Here we go. All right. The last thing that I want to mention, and it's also National Farm School Month during October. And this year we have a local products challenge. And this challenge is for schools can sign up to participate, and it's to give schools recognition for serving an average of 3 local products a day on the line in the meals that they serve. And so those schools, any school that signs up and meets the requirements of the challenge will be spotlighted on our website. And then those who serve more than 3, we will also recognize them as well with a special certificate from the Texas Department of Agriculture. There'll be a special way to recognize them. So please get the word out about the local products challenge. They can sign up right here. There's a form if they want to register. And if they want to learn more about it, they can download the flyer. That's it for me. I just want everybody to know these materials are out there. I think a lot of people don't know just yet. I think they're just getting their feet wet, of course, with school starting and just trying to get that underneath them. So if there's people that you come across in the next month or so on staff at school nutrition directors, cafeteria managers, principals, anyone like that, please communicate out to them that TDA has materials waiting for them and ready to be distributed and used.
Does anyone have any questions?
No question. All right, Chrissy, thank you very much.
Yeah,
I appreciate you
bet.
coming,
Thanks, everybody.
coming over. Now, this takes us into our facts and action portion of the presentation, and we're going to head out to Region 15. And it's my pleasure to introduce Sarah Smith with Brady ISD. She is going to give us a presentation about what Brady ISD does to promote SHACs and action. And Sarah, I'll turn this over to you.
Thank you very much. It's a pleasure to be here. I have a slideshow, I believe. I sent them.
Let me get there.
I'm the director of school nutrition here. This is my third year. I've been a member on the SHAC since 2007. I'm also our wellness coordinator for our district, former PE teacher. So on the SHAC, I wear many hats. Move on to the next slide, please. That's my family. My son, Southern, and my daughter, Emma. And we raise them on fruits and vegetables. So big advocates for health school. Okay. This is mission statement for Brady ISD. For our SHAC is to ensure that all students grades pre-K through 12 will have healthy minds and bodies throughout the modeling of healthy behaviors, nutrition, health education, both academically and physically. And the next slide kind of shows you a little bit who's on our SHAC. But as most SHAC members will tell you, it's probably one of the hardest things to get. But we have some tricks up our sleeves to get parents involved. And it's a little bit easier because they're usually your neighbors, and rub elbows, bribe them a little bit to get on the SHAC. But anyway, invite our their feedback. Our or a board member is present at our as well as the SHSM. Myself, we have a director, very involved. Every year, our school has we think it's real important to get our students' opinions, and we like to invite the student body presidents. They are a voice for their campuses, and they can kind of take back what they learn and share it with the body. Get our parents who are on PA. Important to have that. Take a look at letters out. We have a booth there. It's also on the website. It has a table presentation that adds that one way we recruit. Next slide, please. Our meeting. One of the big challenges that we have, of course, is to get everybody there. We do try to meet more than the required 4 times a year because we just find that it's just near impossible to get the things done that we need to get done. But the one thing we're looking at is to do a monthly for those kinds of 12 o'clock spots. So that's
dialogue, the emails, depending on the word that couldn't. Next slide, please. Previous years, our focus has been, since I've been on the SHAC, childhood obesity, we've hit school nutrition, we've tackled bullying, suicide prevention plan was last year. We've had a wellness fair for our students back in the community that was extremely successful. It was a lot of work, but we would like to do that again. And then counseling and mental health services. Next slide, please. We'll just take a little bit of a side of why we chose some of those topics. I had the privilege of going to the Southern Obesity Summit. Georgia on school before it. And it was very eye-opening. Not the Southern highly recommended. Wonderful. Here's the website. Southern.org. Like information about that. Next slide.
That's hilarious. Oh.
They have some salad. Moving on to the next slide. So last focus, we really hit that hard stuff. Those are very statistics. If you can read that slide, it's projected that the kids in the U.S. are going to have life experience than their parents, and that's the first time in history. So we wanted to make sure that our parents knew that. So we hit that pretty hard. But we did, next slide. Another statistic for you, what's in a lunchbox? The average child consumes 275 pounds of sugar per year, which is almost 3/4 of a pound each day. And so what we wanted to take a look inside. Next slide, please. What did our parents know? When I was a PE teacher serving on the SHAC, I was able to survey our parents when we had a family night. Next slide, please. And I won't go into detail what we surveyed, but we just kind of get what they thought was healthy, what they I apologize for that. But basically, the questions were how often do you go out to eat, or how often do you cook your own meals? Do you think Brady So based on the survey results, we decided the next year we would tackle school nutrition. Next slide, please. And so back in 2010, again before the reauthorization happened, we decided to dissect one of the menus that the previous school director was using. And what we had found was they were using mostly white flour and sugar and canned items that's not fresh. And so we decided that year that we were going to tackle that, and we developed a menu planning committee through the SHAC and worked with the director to try to get some more healthier items on the menu. Next slide, please. We also, like I said before, we did a wellness fair, and it was a lot of work. I'm not going to lie to you, but it was a lot of fun. And those were some things we had to do. We sent out a vendor invitation letter. We advertised in the paper. We got prizes and donations. That way the kids, we developed the scorecard that you see here, and you can also see the vendors that were there. And the kids came through. They could do the scorecard, get put in for a prize drawing. We had a setup crew. We had students involved, helping us with the fair itself. And it was just wonderful. We opened that to the community. Next slide. That we were able to get through with the board was the suicide that was required for us for school district to have. And we got time and share more information about that. We did some research, found a couple, we started it down. We had an post-ask prevention, and we had a mini training with our SHACs first. Then we decided to adopt it, presented it to the board, and asked them to write it in improvement plan at campus so that there was adequate people trained on each campus to provide training and be able to do the suicide prevention. So that actually takes place with principals, counselors, one other will be sent to all the so we were really excited. So next year, we are going to be updating our wellness policy, and probably most schools are going to be doing that. So our goal is to attend the wellness policy workshop. I've been working with Region 15. They know they're also our people want to get us the impact. Although I
How many schools does Brady ISD have?
we have school. We have an elementary, which is a pre-K through 5th grade that has about 600 students. A middle school, 250, and a high school that has 400. So about 1,300 students altogether.
Well, Ms. Smith, thank you very much. Keep up the good work.
You're welcome.
Keep up the great work
Thank you. I appreciate it.
out in Brady ISD. And now it's my pleasure to introduce Kathleen Hasenpratt. She's with Lake Travis ISD. And Kathleen's going to talk about successes that their School Health Advisory Council has had, as well as how the SHAC provides opportunities for parent engagement. And then she's also going to discuss a few of the challenges that they have. So it's my pleasure, if I can, there we go, to introduce Kathleen Hasenpratt.
Hello. We are very excited to be represented today. I think Lake Travis ISD doesn't feel much bigger than Brady. We're about 8,000 students, but you still have a sense of community, and I think that's what makes our SHAC run so well. We have about 30 active members, the majority being, of course, parents and community members, from clergy to law enforcement, medical representation, and so on. And we try to meet mainly, besides the executive meetings where we're all together, in subcommittees. So I think one of our biggest successes has been getting the subcommittees highly functioning. And the 4 subcommittees that we've focused on are human sexuality, alcohol, tobacco, and other drug, health and fitness, and food and nutrition. And so I think the success that I really want to bring to light comes under the human sexuality curriculum, where I saw parent engagement become such a huge integral force behind us getting some policy change in the district. It's a fairly conservative school district, and yet we're in the heart of Austin, so we know that times are changing, and we have quite a diversity of people represented in our 8,000 students. And so we had abstinence-based only that was being taught in 7th and 8th grade, and we had lots of information from parents questioning whether that was comprehensive enough, and whether the state pregnancy rates and birthing rates in Texas were, being targeted with just the abstinence only focus. And so, although it didn't necessarily represent personal agenda,
I did have parents that were very engaged and asking, good questions. And so through research and almost 4 years of looking at different curricula, bringing in guest speakers, doing web-based research as well, we did end up adding just at high school a choice for the kids and parents. So at our high school, we have, as well as abstinence-based, we have abstinence plus curriculum as well. And we felt it was a huge success when the school board granted that option to high school kids. We do have a very rigorous and robust human sexuality curriculum that I think, as we look at the state trend with teen pregnancy, that we feel proudly of. So I did write that as my biggest success. And Barney, I was going to say, we do have, I think, a slide where I target some of that. So next slide, and we'll just look at that. Yeah. So I feel like joining forces with parents is huge. You can hear that Brady ISD does that as well. Like Brady ISD, we do 2 parents from each elementary, 2 from each middle, but 4 from the high school. And we also are trying a different pattern of meeting. I like that lunch and learn idea from Brady. We're looking at a middle of the day meeting. We'll do some light snacks, but that is a challenge. It's always the challenge to get the parents engaged. Next topic, or next slide, please, Barney. But how do we really lock parents in when we're not just talking about meetings? How do we approach the community at large? Like Brady ISD and many other districts, rather than doing kind of just the health fair, we try to spin it a little differently, although I still admire that model. And what we've done is highlight the internal programming, just us. We don't bring in the community, except if they want to underwrite and support us. We do have tons of banners around showing who has helped us pull this off. But it is then instead showing the fitness gram, and we have kids and parents going through the fitness gram components. We have make your own snack where you can compile different pieces from our food nutrition people on putting nuts and maybe not nuts, different fruits and so on to make your own trail mix. We have athletes from our high school demonstrating how to play a certain sport, and kids are involved teaching kids. We have the counselors presenting on character counts, the particular curriculum we use in-house. And this year, when we do it in February, we would add our bully prevention program, which we've implemented K through 12. And I've spent about 2 years working on that. It's really challenging to be a coordinator. One of my personal challenges is coordinating the bully prevention, the drug and alcohol prevention, and those kind of programmings that are so drilled down to be sure those are being implemented. When I really love the perspective, for instance, that Brady ISD's director has, where she can look at obesity and see how they want to target that. I'm still in the drill down stages of being sure catch is being implemented K through 8, and that the bully prevention is running K through 12. And so the FitSmart Expo allows me to kind of take that broader perspective, working heavily with food nutrition department to pull off that engaged family day. We had a 5K to it. We've had great success. 600 people ran or walked that last February. And we just feel really proud of that and feel it's our best example of family engagement. So challenges we faced, small or big. I also partner, believe it or not, with Dallas ISD. We've done a couple of presentations together, the Dallas people and I, because we want to show that size doesn't matter. So I love that Brady's here, because Brady, you're small. I always feel small. But compared to Dallas ISD, you see what they're doing. So interestingly, look for us at AFERD, TAFERD. We'll be doing that presentation again in December, where we talk about size not mattering and compare Dallas ISD's SHAC and their coordinated school health with Lake Travis ISDs and how those two differ and have similarities. But I agree with Brady ISD. It's basic challenges, timing, having equal representation from schools and parents, and all the coordinated health pieces, and meaty enough agenda, keeping people locked in. How do you keep those parents really tuned in to wanting to grow in the direction that you're kind of spearheading a little bit for them, while allowing them to feel and to know that they have some input in that growth. And then, of course, I'm at the point, I don't know, Brady ISD, if you feel this or other districts feel this, but how do you integrate coordinated school health into the school day
optimally while the content teacher doesn't feel dumped on. We've been pretty good at taking the broadcast, that's our internal TV channel that we use, where kids actually do a lot of presenting. We're using that as a platform to get education out. That's on the kids in the kids' faces every day, the broadcast. And we focus on the nurse curriculum, PE, and nutrition teaks as well that way. But it is very challenging at secondary. So I would say that my biggest challenge is how do you marry what we're doing into the content of the classroom on a daily, if not daily, weekly basis. And so that might be a good topic for discussion at some point with the webinar. Mm-hmm. And that's really what I had presented today, although I have time for questions if we have any.
Any questions from webinar participants?
Okay. Thank you.
Ms. Smith, how do you how does Brady make
Yeah.
sure that they're integrating the components without your content teachers feeling like they're being dumped
I
on?
think that question was for me, but I didn't hear it.
Yeah.
How do you address that in Brady?
I missed the first part of your question. I apologize.
How do you ensure that you're integrating the coordinated school health curriculum that your district uses into the classroom where your content or the teachers aren't feeling like they're being dumped on or given one more thing to do? That's one of the biggest challenges that Ms. Hasenfrantz was talking about at Lake Travis. So how does Brady address that to get a rural perspective there?
I was really hoping to learn from Lake Travis.
Oh man.
It's a huge challenge. I'm right there with you.
Yeah.
Actually, this year, Brady actually, I believe in years past, used to use the CATCH program. I heard you mention that.
That's what we're using.
Unfortunately, it was through Shannon Health Systems in San Angelo, and they lost their grant. And so I guess it went away. It actually went away before I became a PE teacher, so I really knew nothing about that. Actually, they come back, and they're bringing it back to us. Hallelujah. This year we'll have the CATCH program again. And so that's something that our SHAC is really going to look at this year, because we've really not had that to kind of steer us in the right direction. And honestly, I need to not be the PE representative on our SHAC because I'm not teaching it anymore. So that's one of our goals this year, is to get someone else involved who knows what's going on in the PE field. But I'm right there with you. It's a huge challenge.
Well, and one thing we've tried, which, I wouldn't say is great success, but we have 4 weeks a year. We call them Power Weeks, CATCH Power Weeks. And that's when we're asking teachers to be involved in certain lessons we've provided. And we really highlight the coordinated efforts of the nurse, the counselor, the PE, food nutrition. We're all wearing T-shirts that promote the CATCH language. And so those are 4 weeks during the year. We do 1 a quarter. And that's the best we've gotten. And so, again, maybe we talk about that further this year, or at a time when we can all compare notes on that. That would be great learning for all of us. Yeah. Okay, so that half-a-day event for FitSmart is actually a weekend. That's a great sacrifice for the employees, but that's when you truly see the team effort, and we appreciate that. When you have several thousand Lake Travis community members come to that event, it's the payoff. So that is the last Saturday or Sunday. We've switched it between the two, but at the end of every February. We're going into our 4th year this coming February. So the biggest challenge to engage in the community would have to be them understanding, I think, their role. And so we have parents that'll approach like various people, principals, myself, and they don't like the time that a lunch period is. It's at 10:15 in the morning. And so, SHAC can't necessarily get into that minutia. We are wanting the more global impact on the thousands of kids. And so that's hard to discern to that parent, let them understand that we want them engaged, that we may not be the platform, and yet we are the platform to change the standards around how we treat lunches. So I think the role of SHAC is still one of our biggest challenges in engaging parents. And obviously, I think I can't remember who brought this up, but having your superintendent on board is key. And we're still in that growth too. We have a new superintendent. He's in his just second year with us. So I think if you get the superintendent, getting parents engaged will be a lot easier.
Ms. Smith, same question for Brady. Challenges with engaging parents, and how you overcome that.
Our biggest challenge to engaging the parents is just the actual awareness. We've tried things, cooking with your kids, and we've done some after-school fitness things, and it's just getting the awareness out there, and we need to do what it is, why we do it, how they can help. This year was the first year, or this was the first year that we haven't had somebody from the school prepare and step up into it. So I brought the parents to it this year. To be honest, I feel like I came on the staff and I didn't know what it was, what it was about. Almost no one either. So getting back what it is, how we can do it better, rather than really motivate us. If that makes sense.
Yes, ma'am. Absolutely. Any other questions, Michelle? Any questions from other service centers that were joining with us today? Questions for our Texas Department of Agriculture team has left, so if you have questions for myself, Ms. Smith, Ms. Hasenfratz, Anita, we're available for questions. I will take everybody's silence as a no. We don't have any other questions. Thank you so much, Ms. Smith and Kathleen, for presenting, and big thanks to Texas Actions for Healthy Kids for assisting with the webinar today. And if you have any other questions regarding any of the legislative updates or anything, you can contact me, and then the information, which is a great document that Department of State Health School Health Programs has, is also very beneficial. And with that, we will sign off and have a great rest of the week.